All right, Dr. Clark, thank you very much for joining us today. I want to thank you and your staff for all their work. And I know you're busy with these unprecedented times. I also want to say to our viewers that we provided Dr. Clark with some questions that we'll be asking, and that we're recording this on Monday afternoon. So we'll start with the numbers that the state just released a bit ago: 236 new cases of coronavirus disease in Illinois. Where are we at with the numbers, and what's your thinking about where these numbers will go from here?
Sure. Thanks again, Chris, for talking with me. So we do expect numbers to increase. That's something that we've long expected as we expand our testing. What's important, particularly for the Central Illinois region, is to determine whether or not we're at a level of community spread. I don't believe that's the case currently. We are somewhat geographically isolated from Chicago, which is really where most of these cases are coming from. Yes, we are seeing some downstate cases, and we do expect to see more as the testing expands. But fortunately, I think our social distancing exercises are helping and slowing the rate of acceleration of this epidemic. And my hope is, and I believe this to be true, that it's allowing us here downstate, particularly in Central Illinois, to get prepared for when it does come, because ultimately we all believe that it will.
I want to ask about some rumors floating around that DMH employees have been infected. Is there any truth to that, and what steps are being taken to monitor whether an employee may have contacted the virus?
Sure. First of all, no. No DMH employees have been infected, nor have we had a positive case through DMH, and we have had some testing of selected patients based on CDC criteria. Rumors are just that. Once these cases do occur, which we do expect they will be thoroughly reported. But anything other than that is simply just a rumor. As far as protecting our providers, and by extension our patients and our community, we're following the CDC guidance. We're using the appropriate masks and the appropriate barrier precautions, the negative airflow rooms, all the steps that we've been advised to take, we are taking.
We just heard from the governor just a little bit ago about shortages of personal protective equipment across the country. Is that an issue that you're facing as well?
The shortage is real. The shortage is worldwide as this continues to spread and continues to infect people and continues to require medical care. There is and will continue to be a shortage of these items, particularly masks, gloves, gowns, the things that are commonplace in medical care. But when you have a huge surge of patients, like we've seen in many areas, it depletes those supplies. And also hospitals that are preparing are working on building up their stock as well. So everybody's out there trying to find the materials that they need. We are, again, following CDC guidance in terms of use of these things. We're not putting our healthcare providers at risk, based on some potential shortcome. We hope that production of these materials can ramp up. We hope that the strategic national stockpile can be deployed in such a way that it gets to the areas where it's needed and we don't run out of those things.
Can you talk a little bit about who is currently being tested and why isn't testing more widely available?
Sure, testing's a big question. The short story is we don't have enough tests, and some of that is based on how this occurred throughout the world, where other areas were affected first, and they were collecting the items needed essentially to do this testing, because there's a lot more to it than just a simple test. There are specific items that you need to be able to perform this test, specific equipment. We do have good testing equipment at DMH. We are currently testing through IDPH. There are also some commercial sources, LabCorp being one of them regionally that's testing. So there is testing available, but we're following, again, the CDC criteria. They're really keeping us to the high-risk patients, as far as patients who have traveled internationally or have had a known exposure to COVID-19. Also patients that have a specific clinical presentation that looks like COVID-19, and that gets pretty detailed. We have algorithms that we put in place in our emergency departments that allow us to kind of put together a picture of what a COVID-19 case looks like. And if we identify one, we make sure and get them in the appropriate precaution area. And then we also initiate testing.
And as you mentioned, there are no confirmed cases in Macon County right now. Does that give an accurate picture of how many people likely have it here?
I'll be honest, Chris, I'd love to have a better local epidemiological picture. We have not done what I would call surveillance in Macon County, and that's true of many, many counties across the country. We haven't done surveillance because we've been really restricted to testing patients that we think probably have the disease. Now, that is an effective strategy when there is a limitation of resources, because if the ones that you think have it don't have it, then it's less likely that those that you don't think have it have it. So I would like to see some community surveillance as we move forward, as testing materials become more available. I think we will get a more accurate local epidemiological picture. However, my opinion, based on what I know in my practice in the emergency department, I don't think we have widespread cases. I don't think we have community spread in Decatur. That usually would probably show up in the emergency department. I would expect that if we were having a large number of cases, we would be seeing that. We're actually seeing record low volumes in the emergency department, which is nice. It's allowing us to prepare for what we believe to be the upcoming epidemic.
Can you give us an idea about the hospital's capacity to treat COVID-19 patients? We saw a lot of video from Italy and other countries about a lack of ventilators, that sort of thing. Specifically, could you estimate how many beds could be available before your resources would be exceeded?
Sure. That's a bit of a moving target. What I can talk about is, exactly what we have done to prepare to maximize that space first. So we've converted an entire area in the emergency department into a respiratory care unit, and that area has the negative airflow and has HEPA filters and keeping the area clean. So we're separating the patients into that respiratory area as they present to the emergency department. We've also built a 19-bed inpatient unit that is designed for COVID-19 patients. We've got the ORs that could be repurposed into ICU beds if needed. And of course, we have our standard ICU beds. We have backup plans upon backup plans to expand that capacity, essentially to the point where our entire hospital could become a COVID wing if needed. But hopefully we don't get to that point. I think we're as prepared as we can be in terms of having many, many beds set aside to treat these sorts of patients, and then ramp it up as needed once we start seeing more cases.
How long have you been preparing for this?
So
Specifically, I guess.
Sure. So as a health system and as DMH itself, we've been tracking it since the first reported case in late January. As far as aggressive preparation, the kind of 24/7 thing that we're doing now, we've been doing that for about a month. So our first step when we did that was to activate Health Incident Command System, which essentially reorients the entire hospital administration toward this threat. So it allows us to redeploy people across the administrative spectrum to focus strictly on preparation for COVID-19. So that was one of the first steps that we undertook, and that was right at about a month ago. Go ahead.
Well, I was going to say, with that in mind, do you think Central Illinois, are we better equipped for this than other areas of the country? Or where do we stack up, I guess?
Well, I think population density plays a role in this, certainly. And we do have a fairly robust healthcare system in Central Illinois if you look at all the cities around here with large hospitals. And again, the geographic distribution is important. Being a little bit more spread out, I think, helps us during an epidemic. Also, being a bit geographically isolated from large centers such as Chicago and St. Louis that have had more flights coming through and more potential for spread. Learning the lessons that were learned from what happened in Washington State and what's happening in New York and even around the world, what's happening in Italy, we've been able to apply those before we're seeing aggressive community spread. And I genuinely think that's an advantage.
And can you describe the experience that a patient with COVID-19 might have, how long it lasts, symptoms, how severe can it become, and what are the chances that a case will become severe or fatal?
Sure. COVID-19 can take many forms, and I know there's an often quoted statistic that 81% are mild, and that's probably true. I think the best way to explain it is to compare it to influenza, which is something that most people are fairly familiar with. Uh, the illness itself is typically an upper respiratory infection, sore throat, cough, fever, some body aches is what one would generally first experience. It can last up to 2 weeks, which is a little bit longer than you would typically see with influenza. When it does get severe, it tends to get severe around the 5 to 7 day range. And our current epidemiological data in terms of how dangerous this disease is, uh, we know that it's more dangerous for patients over the age of 60. We know it's more dangerous for patients with diabetes, heart disease, lung disease, immunocompromise of some sort. As far as the actual death rate, the most recent estimates are somewhere between 1.4 and 2.3%. Now, that might not mean a whole lot, but if you compare it with influenza, which does kill many people nationally every year, influenza has a well-documented death rate of about 0.1%. So substantially higher for COVID-19 in terms of death rate. And if you break it down by the population that get it, um, you can see death rates as high as 10 to 15% in that over 65 age category or the other high risk groups that we discussed.
What can the general public do to help medical professionals do their jobs and also to show appreciation for your work?
Well, I'll start with the first one. Uh, don't panic. This is a huge deal. I'm not going to say that it's not. This is very important. The things that we're doing, the lessons that we've learned in this country from what's happened in other places in the world, it seems like we may be being a bit extreme with all this social isolation and social distancing, but we're not. And the best thing that the public can do is don't panic, be reasonable about things, understand that this quarantine, self quarantine or home quarantine or social distancing that we're doing is really meant to blunt the impact of this virus, to keep it from reaching so many people at one time that our healthcare system gets overwhelmed. So please stick with those public health measures. I like to tell people it's not about me. It's not about what my personal risk is from this illness. It's about what our public's risk is. Everyone's got a grandmother. Everyone's got a loved one that may have immunocompromise or another chronic medical illness that puts them at risk. Do the right things for those people. Wash your hands. Don't touch your face. Cover your coughs. If you're sick, stay home. That's the very best thing that the public can do to help healthcare and frankly, to show appreciation.
Is there a specific thing that we can watch for that will indicate improvement in the general population? Is there a certain benchmark where things have kind of, turned, I guess?
Um, well, if we're doing widespread testing and there aren't any new cases, that would be a good sign. If you listen to what the epidemiologists are saying, this concept of herd immunity is important. Once enough people have developed the illness that it's not spreading so rapidly, or once we develop an effective vaccine, that would be also another turning point. Reasonably, that's probably not going to happen for 12 to 18 months. But as we continue these measures to slow the spread of the disease, that's going to help us get ahead of it, and then we can actually turn that corner.
Well, we certainly appreciate you joining us today. Is there anything else you want to add that the community should know?
I just emphasize that, again, this is public health at its finest in terms of the definition. Everything that each individual does affects the health of the entire public, and we really, truly have to be in this together.
All right, doctor, thank you. We know you're very busy, so we appreciate the time, and thanks. Appreciate it.
Thank you, Chris.